Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. We're here to explain the medical news of the day, and the abomination known as insurance prior authorization has made its way into the headlines. Health insurance industry heads met with U.S. Health and Human Services and the Centers for Medicare and Medicaid Services and pledged to work on a fix. Is it all lip service, or is there an actual way to fix this dumpster fire? Let's get into it. Okay, so you probably guessed I'm not a fan of insurance prior authorizations. And let me say that in theory, they make absolutely perfect sense. In theory, prior authorization is a way to make sure that the proposed care is reasonable, safe, and cost-effective. Sounds fine to me. But in reality, it is a huge burden that takes up a lot of time and resources and too often ends with patients being denied care for some arbitrary reason. Now, before we get too far into the proposed changes, let's talk about what prior authorization actually is. Prior authorization or predetermination is the insurance's way of determining if a planned procedure, test, or medicine meets the guidelines they have for coverage. So the insurance says they will cover certain tests, procedures, and medicines only if they meet certain criteria. These criteria are supposedly set to make sure that the proposed care is within medically accepted guidelines, is safe, and is cost-effective. For instance, in patients with low back pain, many insurances require a specified time of conservative care before they will allow advanced diagnostic testing like MRI scans or procedures like surgery. Now, unless there is some urgent issue, they often require 6 weeks of treatment with medicines and physical therapies. And while burdensome, that makes sense because the medical literature supports that most people get better with conservative care and don't need those other treatments. Insurance companies will use prior authorization to make sure that the planned test or treatment meets medical standards. Sounds reasonable, right? Insurance companies don't want to pay for experimental procedures, excessively risky procedures, or medicines with limited efficacy. In an ideal world, this could be like a second check to make sure that what the doctor wants to do meets the medical standard. And that would be fine, except who decides what is experimental? In the treatment of back pain, we have seen procedures and treatments that we have been using successfully for decades now, all of a sudden deemed experimental and not covered. So if the insurance company can just label treatments experimental, then they can kind of get out of coverage. Now, the next rationale is cost containment, and as everything gets more expensive, insurance companies have to spread their money out, and they need to avoid paying for unnecessary, unsafe treatments or avoid those that aren't shown to work. Again, I think most people acknowledge that there is not an endless supply of money. So companies need to be judicious, and most of us agree we don't want the money we pay into the health insurance wasted. However, the entire prior authorization process is actually a huge and expensive burden on the healthcare system. There are so many forms that are filled out, phone calls made, peer-to-peer authorizations where the insurance doctor talks to your doctor who has to plead your case for treatment. Lots of time and effort from a lot of people. Your healthcare provider, whether that's a medical practice or a hospital system, has to employ countless people to fill out forms and navigate this prior authorization process. This drives the cost of your care up further. Those people are getting paid. The average is 45 prior authorizations per week per doctor. Whew, I can tell you it's even higher in fields like orthopedics, where we often have to get approval for diagnostic imaging and procedures and surgeries and then medicines too. When prior authorization really first started, it was just for expensive medicines or brand new treatments. So some specialties, like for instance oncology, would have had a lot more authorizations to do and more burden because of the cost of the treatment. It then spread, however, to include less expensive treatments and now even generic low-cost medicines. When you and your doctor are deciding what's next in your care, your doctor also has to kind of predict what's going to be covered and what isn't. So for instance, if you're starting a new medicine, you spend a long time discussing it with your doctor, and then it isn't covered. That's frustrating. It's a waste of time for everyone involved. And there's no standardized way for your doctor to even know that before writing the prescription. And when the prior authorization process is prolonged, about a third of patients never pick up their prescription anyway. That increases the risk of bad outcomes, and oftentimes the patient is back in the doctor's office months later with the same problem, now only worse. Now, with regards to Medicare Advantage plans, HHS, the Office of the Inspector General, found that approximately 13% of denials were inappropriate and would have been covered in traditional Medicare. In 2024, Medicare Advantage plans required prior authorization for 50 million services. These can be slow walked, and that dissuades the clinician from ordering and the patient from receiving care. So, we have a problem, folks. Doctors and patients are frustrated. Just ask my back pain patients who have been denied epidurals because they didn't meet some subjective and arbitrary percentage of pain relief. Well, is this meeting between HHS, CMS, and the healthcare industry going to make any difference? Okay, it was just a meeting. And while they pledged to make changes, there are no rules or laws added that could enforce these, but you got to start somewhere. So it's all encouraging. The insurance companies pledged 6 changes, which are aimed at easing burdens on providers and with the goal of helping patients receive timely care and evidence-based care. Okay, number 1, they pledge to standardize the prior authorization submission. One system, one application programming interface. That makes the process easier, more streamlined, easy to navigate, reduces the amount of time medical providers are spending on data entry. That sounds good. Second, they pledge to reduce the volume of medical services subjected to prior authorization. HHS said that they wanted this to particularly be easier for diagnostic imaging, physical therapy, and outpatient surgeries. Things like knee arthroscopies and colonoscopies were named as procedures that probably shouldn't require prior authorization anyway. Third, they pledged to honor existing authorizations during insurance transition periods for 90 days. And this is actually a big deal because we have a lot of patients who are stable on a particular treatment. And when they change insurance, this is no longer covered. That results in delay of care while we fight to get that treatment covered again. Next, they pledged to enhance transparency and communication around authorization decisions and and appeals. I'm not sure where they're going with this. Most insurances already send you a letter saying why they deny the treatment and then how you can appeal that. The problem is that the appeal process is burdensome. Next, they pledged to expand real-time responses to minimize delays in care with real-time approvals. This should definitely be easier to do as more of them employ AI in their review process. By 2027, they claim 80% of responses will be real-time. As of now, providers may spend literally hours on the phone to get approval for like a simple surgery like a carpal tunnel release. So that would be major. Lastly, they pledged to ensure medical professionals review all clinical denials. And that does sound good. You don't want someone with no medical credentials deciding whether or not you have surgery, right? But insurance companies actually already say they're doing this. And I do a ton of peer-to-peer evaluations where the insurance doctor often agrees that the treatment sounds appropriate and should be done, but still denies it because it doesn't meet the insurance plan's guidelines. So unless you have an insurance doctor responsible to the patient somehow, I don't see how this is going to make much difference, in my opinion. Some rules have already been enacted but haven't gone into effect yet. So next year, insurers in the Medicare Advantage and Medicaid systems will have to provide responses in 3 days to 1 week, depending on urgency. So just like a lot of ideas, in theory, prior authorization makes perfect sense. But in application, it is a monstrosity that costs too much, hurts patients, and demoralizes doctors. Do I think we should take the reins off and let everything ordered or prescribed be done immediately, right away? No, of course not. We do need to be responsible with our limited healthcare dollars. Providers should be able to justify what they do. And if you don't have sound justification, insurance shouldn't have to cover it. Good doctors are okay with checks being in place on what they do because we have sound rationale for why we want to do a proposed treatment. There's probably some happy medium here. I'm encouraged that people are at least talking about this and looking towards solutions. and we'll keep our eye out for updates for you. Now, I've spent a lot of time talking about how this burdens the healthcare providers. And as one, I can tell you, it is really miserable to fight insurance companies constantly. But more importantly, as a patient, it can literally mean access to care being limited by someone who isn't your doctor and isn't responsible for your bad outcome. My family was hit with this when my husband, who has a rare autoimmune kidney disease, needed an infusion that has kept him in remission, off dialysis, and quite frankly, alive for the last few years. This medication was so effective that he was able to live a pretty normal life for about 5 years after that first treatment before his relapse. All of his doctors, his 2 nephrologists, including a specialist in this particular disease at the National Institute of Health, and his hematologist, all prescribed a second round when he relapsed. This drug is the standard of care for what he has. It's pricey, but it's widely used for lots of other conditions as well. Should have been a no-brainer, right? Nope. Insurance denied it as not medically necessary, despite it being the standard of care and life-saving. They didn't have a reason, other than it wasn't on their list of covered diagnoses. Their only recommendation? To take the medicines he was already on and failing. When provided with all the literature showing this was the appropriate treatment, the insurance doctor agreed. However, said, insurance has not updated their guidelines in 5 years, so it would not be covered. Now, my husband has amazing doctors who got us through this process without the insurance authorization, and the treatment was again a success. But what if I wasn't a doctor? What if I didn't understand the system? What if he didn't have the backing of his amazing doctors pushing to get him his care? What if he hadn't been treated by an expert at NIH who literally wrote the protocol on how to treat this disease? So I see the huge error in the system from the doctor and the patient side. And I'm very encouraged to see some robust conversation on improving it. Thank you again for joining us today. Please like us and share and subscribe. You don't want to miss out on any of our upcoming content. Thank you again. Wishing you good health. See you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.